Hey guys, it's Dr. Girdwood here at Coastal Chiropractic in Port Charlotte. Jessica is kind enough to let us record her adjustment today, so you can kind of get a close up on what it's like to actually get adjusted here in our office. Jessica's a teacher here locally, so she is constantly on her feet, going from a seated to a standing position. When she's not standing, she's grading papers, so she has everything from lower back, mid back, neck pain. She gets headaches occasionally, so we're just kind of walking through the adjustment, and so you guys can get a better understanding of what it's like here. So, thank you, Jessica.
No problem.
So Jessica's had a lot of lower back and hip issues that she's been dealing with, and she actually first came to our office with right-sided pelvis pain. And we pretty much got that taken care of. Now she's on more of a maintenance standpoint. Okay, keep your right leg straight and lift it as high as you can for me. Good, and down. Now left leg as high as you can. Good. So what I'm doing here is I'm checking her pelvis, and I'm actually, let me flip it over to the other side so you guys can see it. Okay. One more time. Lift your right leg up as high as you can, and down, and now left leg as high as you can. If you watch and compare, actually, when she lifts her leg, she can lift her left leg higher than she can lift her right leg. And what that tells me is that her SI joint is locked up and her pelvis is actually creating more of an issue. Now, she may not feel symptoms yet from this, but what it tells us is that that's fixated and eventually could start to create some symptoms for her. So we're going to get that taken care of before she leaves today. And since she always has mid-back pain and tightness, and we're going to be adjusting her lower back and her neck, we're still going to adjust the mid-back just to make sure that this area stays mobile and stays kind of freed up so it doesn't create issues in the future. So let me have you go and just kind of let your arms hang down on the ground. And just relax, let the shoulders go. And then one more right here in the middle. Okay, now we're going to flip her over and take a peek at the neck. Okay, so like I said before, Jessica has dealt with a lot of neck pain, a lot of headaches, and it comes a lot with just postural things, just what she does at work, grading papers, constantly on and off her feet. I'm sure yelling at kids here and there. So,
Yeah.
So with her neck, we have lower cervical issues on her left-hand side, and she actually has atlas issues on the right side. So we're actually going to show you both of these adjustments here. And the first one we're going to show you is the lower cervical on the left. So basically, again, if you look at her face is forward always with these adjustments. So we don't want to create that rotation, because when you rotate, that's when you start to occlude that vertebral artery, and that's what we don't want to do, is put more pressure onto it. So her neck, right there is her lower cervical, and then her atlas issue that she has over here on the right-hand side. Usually it's a little bit louder to the patient, but a little bit more of a delicate adjustment because we got to be so high. And if you'll see, there's not as much lateral flexion, because the lower you go in the cervical spine, the more lateral flexion you're going to have. So with our atlas, we're way up here high, and I'm just going to have you kind of bring the chin to the left just a tad. Just like that is our atlas. Okay, like I said over in a second ago, is that she has right SI joint issues that she gets, and it's kind of a chronic issue for her, something that she has every single time she comes back in. And we checked it with the leg check a minute ago. So what we're going to do is we're actually going to kind of roll herself into extension here, and we're going to create kind of a torque. But the pressure always here on these adjustments comes from the back. It always comes from back to front. So we're going to kind of bring her over, and she's going to feel that thing lock out, and then we go to move that hip. So it's moving just like that. Come on. There you have it. So feeling pretty good?
Yeah, a lot better.
Well, first off, thank you so much for letting us record your adjustment. Jessica's basically a maintenance care patient. She comes back about every month to 6 weeks, just because she has a job that's kind of rough on her body. If she ever has issues, she comes in sooner, but she's actually just doing pretty good recently, right? So
Yes.
thank you, Jessica,
You're
and
welcome.
thank you guys for tuning in. Appreciate it.